Expect tourniquet inflation device for proper function.
Okay, we'll say this is my machine.
So select appropriate size tourniquet cuff for extremity.
Okay, so I have 3 sizes here. Oh man, I'm wearing gloves. Guess what I get to do? Alright, so purple is 34 inches. Blue looks a little bit bigger. And that one's the smallest. Let's check this leg. Keeping the patient covered for privacy. We're coming all the way up here, but I just gotta make sure I got the right size tourniquet. What do you guys think? No? I don't think so. I think that's too small. Blue, please fit, because that's the only other size we got. Yep, we're good.
Assess skin site before application of tourniquet.
All right, my skin looks good. No abrasions, no cuts. It's kind of old, but hey, that's cool.
Wrap area for tourniquet placement with cotton padding.
All right, I need a help. Help! Help! Hi, other circulator. Can you go ahead and put on some gloves for me? I'm gonna need you to mush some stuff out the way for me. You can say mush too. Mush some stuff out the way.
That's move and push.
It is. So I'm gonna need you to come over to this side, and I need you to just pull all this to the side for me. Yeah, just pull it over there. Get out the way.
You can use a towel too if you like. It's up to you, whatever you like.
Make you feel more comfortable. So you're literally just getting in there and pushing. Get it all the way out the way for me. A lot of times this leg comes up. We get very comfortable with these patients. How you doing?
Good, how are you?
I'm good, I'm good. I'm just trying to live my best life. Living my best life. Putting on this tourniquet. Okay. Where am I at, Ed?
Apply tourniquet over cotton padding. Attach tourniquet tubing to tourniquet inflation device.
All right, so my tubing, my inflation device is this way. All right. So a lot of people get caught up on making this. This has to be as tight as possible. How do I make this tight, you ask? Well, you're pulling and making sure that you're down. And this is why you don't want to get it caught in their junk.
I'm gonna have to go for hip surgery.
It doesn't hurt you at all. It doesn't hurt you one bit.
You should see how the foot is on you. We got a back scratcher.
Okay? And then I'm looking. Oh, the hip did move. So the other thing I'm looking is making sure that there's no blue part on this person. So white, white, white. Everything's covered. Cool.
Okay, wrap extremity with S-marked latex bandage from distal to proximal end of the level of the tourniquet.
Which we don't have the 10-10s. Do we have any 10-10s? Because sometimes we use that. Remember, she's not. Don't hurt her. I'll have to cut that part out. So the other thing that we do for this, can you hold this for me? Is we'll wrap this around.
You can go ahead to the front.
You can? Okay. And then this one we would have to use 2. But it just goes to protect it. There's another layer. So you'd have one this way and then one on the bottom.
Okay, check the pressure gauge and inflate the tourniquet to the designated pressure.
All right, what's next?
Inflate it. If a commercial prep applicator is used, the student is able to describe the correct technique for product.
Okay, so now I'm taking off my purple gloves into the trash. I'm going to wash my hands, performing hand steps. I don't ever use these gloves. I like to prep before I get everything ready. It's just good practice, especially if you have a lot of crazy stuff.
Can I get your?
Hey. Did you get that? That's even better. Teamwork makes the dream work. How many times have I put that on people's sheets?
Every time.
But I always ask. Teamwork makes the dream work.
Not all nurses like it.
You guys gotta make sure you know how to open glove. So by the time I'm gloved, like, thank you, girl. You're welcome. Cool.
Do you really want me to pour?
How many do we have?
4.
No, we have.
Okay, so the green goes with the lollipops, and the scrub goes with the sponges.
I'm sorry, you're the scrub.
No, I'm a circulator. So the scrub, this is teamwork. So the scrub can always get your prep ready for you while you're doing other stuff. But it's all about communication. I'm cool with it. I'm like, thank you. Because then now I'm like, cool, I'm ready, thank you.
You're very welcome.
So, but keep in mind, you might find that nurse that is like, no. But most of the time, I've never had an experience where they're like, not cool. I've always had good experiences. You have?
Yes.
So you just have to ask. So, like she showed you, we don't have any belly button to clean because why?
Because there's no belly button exposed.
Correct.
Okay. Student checks surgeon's order for prep solution tincture, checks patient charts for allergies, takes appropriate action if allergy or prep solution or latex are documented in the chart.
Okay.
Sends prep supplies, prepared sterile field on prep table as needed. Opens sufficient number of prep applicators used or pours antiseptic solution in a small basin.
Mm-hmm.
Performs hand antisepsis.
What you guys saw me do before I even came over to my room.
Circulator elevates operative leg and places drip sheet over operating table to keep it dry.
So, in this case, I have a second circulator. Oh, I forgot to put a chucks down. Hi, extra circulator Bree. Can you do me a favor? Can you go ahead and put a chucks down or towels down under my leg? Yeah, because remember, you're the help. You're not sterile. So just remember to put this down first, okay, guys?
The leg is placed in the holder if applicable. Don sterile gloves. Covers tourniquet cup with surgical towel secured with plastic adhesive drape.
Which we've already done in the last one, so we're good.
Uses no touch technique with prep sponges secured in sponge forceps or used commercial prep applicator.
So there's a lot of ways you can do this. A lot of times we'll raise the leg up first. But let's say Bree's like, man, my back hurts. So I'll wait till the last minute to have her pick up that leg. Okay? So, right? Incision site first. Circumferential. Okay? So I'm doing the top first. One thing you guys got to remember, now you have clean, dirty, clean, dirty. Same concept as before. Keep in mind, what you'll see, you guys see that would go in there. What you guys got to keep in mind is nowadays the biggest point of the prep is just to prep the patient. We're not going to get into specifics of up, down first, left, right first. The biggest thing is these toes are dirty, so they have to be done last. So when you get out into the real world, you're going to see the prep done all kinds of ways, but you won't notice one thing in particular: the toes are done last. Okay? So at this point, this is what I kind of like to do. She has changed to sterile gloves. Okay, she has on sterile gloves now. I like to go ahead and hand out, kind of wipe her hand out. Do you guys know why?
To make it more sterile?
Well, no, because now she's going to touch the skin on the toes that I haven't prepped yet.
Oh,
So
okay.
can you lift those up for me?
So body mechanics
Body mechanics, yeah.
goes to the end of the table.
So your hands are going to be wet and sticky too?
Well, sterile gloves.
Yeah.
So the reason I'm doing this is because I'm going to take this from her. Okay, I'm going to take it from her. So I've already cleaned her, and I'm going to take it from her. So I'm doing everything. I'm cleaning, 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 cleaning.
I love to clean.
And make sure I get the foot. Because look what I'm doing right here. So I've gotten the foot. Thank you. I'm good. So from here, it's me by myself. All by my lonesome.
I still love you.
Well, thank you. Remember what I told you in ortho, if it's not sloppy wet, they're going to think you did not do anything. Now this is where it gets kind of fun. If she's still in sterile gloves, she can help me drape or dry off the patient. But let's just say I'm one of those techs that don't really trust humans. You got to get used to being able to do things with one hand. And drape.
And
dry.
not contaminate.
So you guys saw how I did that? One. Remember, I just graduated in October of 2000. What? And I'm just patting it dry. Okay? First one you put up. Oh, the first one you put on is the last one you take off.
Do you dry between toes too?
If you can. If you can't, you don't want to kill yourself.
We don't want the.
What did you guys notice about how I took this off? Okay, did it contaminate anything so far?
Mm-hmm.
So the last thing you do, am I going ahead?
Yeah, but you know,
Sorry, Abe. Go ahead, sorry.
student preps at knee, continues around the circumference, and then move to the upper and lower leg away from the knee to the tourniquet and foot.
Okay.
Yeah,
So you've already done that.
gathers prep supplies and discards them in
Okay,
appropriate
so
receptacle.
paint. So I painted. All right, scrubbed. Now I'm gonna paint. We have 3. So you guys see that motion? I'm kind of squishing it, get in between those toes, discard. And if you notice, what do you notice about my arms? How close is this to my body?
Close.
And of course, you know you're gonna make sure you don't miss any spots, right?
And that's what my eyes are for too.
Mm-hmm. 2 eyes are better than, well, I got 4, but it's cool.
So do I. You just can't see my other 2.
Oh, you're wearing contacts.
You guys are like a spider team.
All right.
Okay, gathers prep supplies and discards them in appropriate receptacle. Documents prep correctly in patient chart.
Okay. Now what? Where are we at now?
After gowning and gloving correctly, student correctly positions the sterile impervious drape over the non-operative leg
Here we go.
and operating table.
So now, Bree, you get into gown and glove. You're gonna be the second surgeon. You're gonna be Ms. D's assistant.
Can I get a gown and glove, please?
I have a gown.
So you see how this works. This is why you guys are teams. Why you're gonna be rotating through different positions. Luckily, with the size of groups, there should be 3 groups of 4, 1 group of 6. You guys will be able to rotate through every different position, okay?
Nicely.
I did not see that. My eyes are over here.
Stockinette and correctly unfolds it towards the knee, stopping 4 to 5 inches below the patella. Secures the stockinette using co-band bandage.
All right, doctor, you got it? Got it?
Yes.
Okay. You guys saw that. I did not let go until she was secured. So let me get
My hands are in the cuff of.
Yeah, I'm gonna
Any
take that.
other scrub?
Yeah, can the other surgeon actually roll down the studding neck?
Yeah, I'm gonna become the second surgeon real quick. Come on. You're the assistant, so you do what the surgeon says. And one thing you're watching, Miss Bree, you just contaminate. You gotta be careful. It's all about body
I
mechanics.
always start this first, so I don't have to sit here and struggle left. And I always do it this way. So I don't do it. See, there's 2 ways to do it. The scrub, you can do it this way, or you can unravel it this way.
Yeah, with them all the way. You have different when you have a circular scrub that knows, like you gotta open this one, I can't touch them.
So you can hold the foot. Come over here. Yeah.
Body mechanics, Miss Bree. Working all over.
Not too tight. Okay, now come back up here to the foot, please.
It's all right.
This is she.
Doing the stucking it first,
Yes.
you don't have a high probability of getting contaminated versus putting a half a sheet first in the.
So it depends. You, a lot of times we do it simultaneously. So what would normally happen is I'm already scrubbed in. While she's doing that, I put down the half sheet while they're wrapping, simultaneously. But if for some reason it's just the two of them, there's no problem doing it this way either, as long as you're just watching to make sure you don't contaminate. Hey Doc, sorry I'm late. I had to go eat pizza.
Gee, thanks.
Okay.
So,
Tied up.
her and I are going to change places. Watch how this works. Okay, let go. You come over and help her.
Back to back.
Come on, Bree. You can tell this is old. So we can't do anything about that. So what can we do? What can we do?
Now,
Towels or, is there a half sheet up there? So what should have happened? So when you're grabbing it, when me and you switch places, you're grabbing everything. I'm holding up and then you're coming over. Okay? Okay?
Great places split drape correctly, tails down, 5 to 6
Extremity
inches
drape.
above the knee and secures the adhesive edges. Unfolds the remaining portion before the patient's head.
All right, stop. Now, since we have this one, let me show you a split sheet. So same thing. The only difference is, did it say down or up? Tails down or up?
Tails down.
Okay. Yeah, so just let it out, tails go up. You're right. So in this instance, okay, Bree, we'll switch. You stay here. I'll hold the leg. She'll hold the leg. Folds, watch, everything's cut. As you notice, she's helping. With this particular drape, we're not going to take the stickies off because we only have 3 of these. Stickies come off. And I always ask the doctor, would you like to kiss or cross? Kiss, meaning these 2 stickies are going to, so Bree, when you're grabbing it, you got to see how the doctor's doing it. When you're grabbing it, you should be holding this part right here, okay? So when we say kiss, that means sticky to sticky. That's kissing. When we say cross, that means one goes down, the other one goes over. That's the other way to do this particular drape. Okay? Kiss or cross. Are we kissing or are we crossing? All right? Thank you, Miss Steve. Thank you, Miss Bree. Hey, you got us?
Okay, yep. With the assistant holding the foot, student moves foot and lower leg through an aperture drape correctly and positions it above the knee, correctly passes the upper portion of the drape to the anesthesia provider. Removes paper backing from the inside drape and wraps it correctly around the knee, further securing the drape edges. Throughout the procedure, the student maintains aseptic technique, opens drape folds with minimal movement, avoids contamination throughout the procedure, deflate tourniquet cuff at the end of the case.
Perfect. Case is done. Tourniquet down. What was my tourniquet time? When they're asking about tourniquet time, you're talking about the time the tourniquet went up before the case started, what time the tourniquet just came down, and how long the tourniquet's been up. Remember we talked about that. How long can a tourniquet stay on a lower extremity?
1 to 2 hours.
1 to 2 hours. How long for an upper extremity? No more than 1 hour. That is a CST question. Okay? And it's real world application. You want to know how we get over that? Tourniquet down. Last sponges, we wrap. Leg up. Tourniquet down for 5 minutes. Tourniquet back up. It's not ideal, but in those instances when we still have more work to do, that's what happens. Real world application. All right?
After removal of drapes, remove flexible latex bandages around tourniquet. Document tourniquet time. Document tourniquet inflation and deflation times. And then reassess skin site.
Bree, you gotta get rid of that stuff. So we're working as a team. You see how fast I'm moving? There's still more stuff where you gotta, it's all about watching, helping, okay? This is where we're helping each other. No one's just standing around. You see how Ms. D just adjusted? Sometimes we cut scissors. Sometimes we'll just take scissors. Take it all off. Take it all off. Now, to take off this tourniquet, tourniquet's already deflated. And when we say ortho is like this at the end, they are not joking. At this point, dressings come on and everything like that.
And the last thing is a document time tourniquet removed.
That was it.
Like removed.
Removed from the scan. You have tourniquet up, tourniquet down, total tourniquet time. What time do we get this off?
Okay.
You rarely will see that one, but it's there, so just make sure you have it.
And you.
And when you guys are doing this, we don't want to hear tourniquet up. I want you guys to look, tourniquet up, 10. However long it takes you guys to do this lab, right? Tourniquet down, 10:05. Total tourniquet time, 5 minutes. So real time, okay? We don't want robots. We want you guys to really get into it. Because a lot of times you're going to be the one looking where they're like, tourniquet up. And it'll be us. I usually sometimes write it down, tourniquet up. And I usually do this, up, arrow. Wow, and it's so much. Circulator's writing it up. I'm writing it here because remember, sometimes you do turnover. So on the board, off, perfect. Neural is big when they're doing different things. When they're saying,
Here too.
yep. So,
If
any
the
questions?
circulator's out of the room and the tourniquet goes down, you have it on your table.
Yep. Any questions?